BPSC BPS 17, Medical Officer and Lady Medical Officer. Paper 7. 100 most repeated questions taken from authentic past papers. Put your headphones on for better focus. After each question you get 5 seconds, pause if you need to. Let us begin. Question 1. A mid-diastolic murmur is characteristic of Option A. Tricuspid regurgitation. Option B. Mitral regurgitation. Option C. Aortic stenosis. Option D. Mitral stenosis. The correct answer is option D. Mitral stenosis. Let's go through the options. Tricuspid regurgitation. Tricuspid regurgitation gives a systolic murmur, not mid-diastolic. Mitral regurgitation. Mitral regurgitation is pansystolic. Aortic stenosis. Aortic stenosis is an ejection systolic murmur. And the correct answer is mitral stenosis. Correct. Mitral stenosis gives a low-pitched mid-diastolic murmur at the apex. So, the right answer is option D. Mitral stenosis. Question 2. Hemochromatosis causes all of the following except Option A. Cirrhosis. Option B. Diabetes mellitus. Option C. Diabetes insipidus. Option D. Cardiomyopathy. The correct answer is option C. Diabetes insipidus. Let's go through the options. Cirrhosis. Iron overload causes cirrhosis. Diabetes mellitus. It causes bronze diabetes, diabetes mellitus. Cardiomyopathy. It causes a restrictive dilated cardiomyopathy. And the correct answer is diabetes insipidus. Correct. Diabetes insipidus is not a feature. Hemochromatosis affects the anterior pituitary pancreas, not AD. So, the right answer is option C. Diabetes insipidus. Question 3. Pernicious anemia is caused by autoantibodies to Option A. Transcobalamin. Option B. Thyroid peroxidase. Option C. Parietal cell ATPase only. Option D. Intrinsic factor. The correct answer is option D. Intrinsic factor. Let's go through the options. Transcobalamin. Transcobalamin is a transport protein, not the autoantibody target. Thyroid peroxidase. Thyroid peroxidase antibodies belong to thyroid disease. Parietal cell ATPase only. Parietal cell antibodies occur but are less specific than the answer sought. And the correct answer is intrinsic factor. Correct. Intrinsic factor antibodies are the specific cause of pernicious anemia. So, the right answer is option D. Intrinsic factor. Question 4. Addison disease characteristically causes Option A. Hypercalcemia. Option B. Hypernatremia. Option C. Hypokalemia. Option D. Hyponatremia. The correct answer is option D. Hyponatremia. Let's go through the options. Hypercalcemia. Addison causes hypercalcemia only occasionally. It is not the hallmark. Hypernatremia. It causes low, not high, sodium. Hypokalemia. It causes hyperkalemia, not hypokalemia. And the correct answer is hyponatremia. Correct. Cortisol aldosterone deficiency causes hyponatremia with hyperkalemia. So, the right answer is option D. Hyponatremia. Question 5. Tuberculosis of the spine is known as Option A. Charcot joint. Option B, Pot disease. Option C, Skewerman disease. Option D, Pert's disease. The correct answer is option B, Pot disease. Let's go through the options. Charcot joint. A Charcot joint is a neuropathic joint, not spinal TB. Skewerman disease. Skewerman is adolescent kyphosis. Pert's disease. Pert's is a vascular necrosis of the femoral head. And the correct answer is Pot disease. Correct spinal tuberculosis is Pot disease. So, the right answer is option B. Pot disease. Question 6. Renal artery stenosis in elderly men is most commonly due to Option A, fibromuscular dysplasia. Option B, atherosclerosis. Option C, vasculitis. Option D, embolism. The correct answer is option B, atherosclerosis. Let's go through the options. Fibromuscular dysplasia. Fibromuscular dysplasia affects young women, not elderly men. Vasculitis. Vasculitis is a rarer cause. Embolism. Embolism is uncommon as a cause of chronic stenosis. And the correct answer is atherosclerosis. Correct, in elderly men renal artery stenosis is usually atherosclerotic. So, the right answer is option B. Atherosclerosis. Question 7. Fibromuscular dysplasia of the renal artery is treated by Option A, bypass grafting. Option B, nephrectomy. Option C, percutaneous transluminal renal angioplasty. Option D, medical therapy alone. The correct answer is option C, percutaneous transluminal renal angioplasty. Let's go through the options. Bypass grafting. Bypass grafting is not first line for FMD. Nephrectomy. Nephrectomy is not the treatment. Medical therapy alone. Medical therapy alone does not correct the stenosis. And the correct answer is percutaneous transluminal renal angioplasty. Correct, fibromuscular dysplasia responds well to percutaneous transluminal renal angioplasty. So, the right answer is option C. Percutaneous transluminal renal angioplasty. Question 8. Iron deficiency anemia is best diagnosed by Option A, serum ferritin. Option B, serum iron alone. Option C, hemoglobin alone. Option D, peripheral film alone. The correct answer is option A, serum ferritin. Let's go through the options. Serum iron alone. Serum iron alone fluctuates too much. Hemoglobin alone. Hemoglobin alone does not identify the cause. Peripheral film alone. A film is suggestive but not confirmatory. And the correct answer is serum ferritin. Correct, serum ferritin, low, is the best single test for iron deficiency. So, the right answer is option A. Serum ferritin. Question 9. Blood transfusion reaction causes all of the following except Option A, hypertension. Option B, fever. Option C, oliguria. Option D, pain at the transfusion site. The correct answer is option A, hypertension. Let's go through the options. Fever. Fever is a common reaction. Oliguria. Oliguria occurs with hemolysis. Pain at the transfusion site. Pain at the site can occur. And the correct answer is hypertension. Correct, a transfusion reaction causes hypertension, so hypertension is the exception. So, the right answer is option A. Hypertension. Question 10. Digitalis toxicity is aggravated by hypokalemia and option A. Hyperchloremia, option B. Hypocalcemia, option C. Hypernatremia, option D. Hypercalcemia. The correct answer is option D. Hypercalcemia. Let's go through the options. Hyperchloremia. Hyperchloremia is not the classic potentiator. Hypocalcemia. Hypocalcemia does not aggravate digoxin. Hypernatremia. Hypernatremia is not the classic factor. And the correct answer is hypercalcemia. Correct, hypercalcemia with hypokalemia aggravates digitalis toxicity. So, the right answer is option D. Hypercalcemia. Question 11. Giardia lamblia causes disease in all of the following except option A. Chronic diarrhea, option B. Malabsorption, option C. Pelvic inflammatory disease, option D. Weight loss. The correct answer is option C. Pelvic inflammatory disease. Let's go through the options. Chronic diarrhea. Giardia causes chronic diarrhea. Malabsorption. It causes malabsorption. Weight loss. It causes weight loss. And the correct answer is pelvic inflammatory disease. Correct, Giardia does not cause pelvic inflammatory disease. So, the right answer is option C. Pelvic inflammatory disease. Question 12. Steroids are contraindicated in option A. Asthma, option B. Herpes simplex keratitis, option C. Nephrotic syndrome, option D. Ulcerative colitis. The correct answer is option B. Herpes simplex keratitis. Let's go through the options. Asthma. Steroids are used in asthma. Nephrotic syndrome. Steroids are used in nephrotic syndrome. Ulcerative colitis. Steroids are used in ulcerative colitis. And the correct answer is herpes simplex keratitis. Correct, steroids are contraindicated in herpes simplex, dendritic, keratitis as they worsen it. So, the right answer is option B. Herpes simplex keratitis. Question 13. Papilledema with a swollen optic disc is treated initially with option A. Steroids only, option B. Acetazolamide, option C. Mannitol only, option D. Antibiotics. The correct answer is option B. Acetazolamide. Let's go through the options. Steroids only. Steroids alone are not the initial measure for raised ICP-related disc swelling. Mannitol only. Mannitol alone is for acute crisis, not initial ongoing therapy. Antibiotics. Antibiotics are not the treatment. And the correct answer is acetazolamide. Correct, acetazolamide lowers CSF production and is used initially for papilledema of idiopathic intracranial hypertension. So, the right answer is option B. Acetazolamide. Question 14. Sarcoidosis in children most commonly presents at about option A. 5 months of age, option B. Birth, option C. 10 years, option D. Adolescence. The correct answer is option A, 5 months of age. Let's go through the options. Birth. It is not present at birth. 10 years. 10 years is not the earliest presentation. Adolescence. Adolescence is later than the early onset form. Uncommon item flagged. And the correct answer is 5 months of age. Correct childhood, early onset, sarcoidosis can present in infancy around a few months of age. So, the right answer is option A. 5 months of age. Question 15. Aspergillosis is most commonly associated with option A, sarcoidosis. Option B, emphysema. Option C, bronchiectasis. Option D, pleural effusion. The correct answer is option C, bronchiectasis. Let's go through the options. Sarcoidosis. Sarcoidosis is not the classic host for aspergilloma. Emphysema. Emphysema bullae are a less classic site. Pleural effusion. A pleural effusion is not the typical site. And the correct answer is bronchiectasis. Correct. An aspergilloma classically colonizes a pre-existing bronchiectatic or TB cavity. So, the right answer is option C. Bronchiectasis. Question 16. Hypertension in a 32-week pregnancy of 155/95 with negative dipstick indicates. Option A, eclampsia. Option B, preeclampsia. Option C, chronic hypertension. Option D, gestational hypertension. The correct answer is option D, gestational hypertension. Let's go through the options. Eclampsia. Eclampsia requires seizures, absent here. Preeclampsia. Preeclampsia requires proteinuria, which is negative. Chronic hypertension. Chronic hypertension is diagnosed before 20 weeks. And the correct answer is gestational hypertension. Correct. New hypertension after 20 weeks without proteinuria is gestational hypertension. So, the right answer is option D. Gestational hypertension. Question 17. Acute glomerulonephritis is characterized by option A, glycosuria. Option B, massive proteinuria. Option C, microscopic hematuria. Option D, ketonuria. The correct answer is option C, microscopic hematuria. Let's go through the options. Glycosuria. Glycosuria points to diabetes, not nephritic syndrome. Massive proteinuria. Massive proteinuria is nephrotic, not acute nephritic. Ketonuria. Ketonuria is unrelated. And the correct answer is microscopic hematuria. Correct. Acute glomerulonephritis shows hematuria, often microscopic, with red cell casts. So, the right answer is option C. Microscopic hematuria. Question 18. Pyogenic liver abscess most commonly follows. Option A, appendicitis. Option B, ascending cholangitis. Option C, diverticulitis. Option D, trauma. The correct answer is option B, ascending cholangitis. Let's go through the options. Appendicitis. Appendicitis is a less common source now. Diverticulitis. Diverticulitis is a less common portal source. Trauma. Trauma is uncommon. And the correct answer is ascending cholangitis. Correct. Ascending cholangitis, biliary sepsis, is the commonest cause of pyogenic liver abscess? So, the right answer is option B. Ascending cholangitis. Question 19. Hypertriglyceridemia predisposes to thrombosis by option A. Raising antithrombin. Option B. Reducing platelets. Option C. Reducing fibrinogen. Option D. Increasing blood coagulability. The correct answer is option D. Increasing blood coagulability. Let's go through the options. Raising antithrombin. It does not raise antithrombin. Reducing platelets. It does not reduce platelets. Reducing fibrinogen. It does not reduce fibrinogen. And the correct answer is increasing blood coagulability. Correct. Hypertriglyceridemia increases blood coagulability and thrombotic risk. So, the right answer is option D. Increasing blood coagulability. Question 20. Interstitial lung fibrosis on chest X-ray shows. Option A. Cavitation. Option B. Honeycomb appearance. Option C. Consolidation. Option D. Pleural plaques only. The correct answer is option B. Honeycomb appearance. Let's go through the options. Cavitation. Cavitation suggests TB or abscess, not fibrosis. Consolidation. Consolidation suggests pneumonia. Pleural plaques only. Pleural plaques alone indicate asbestos exposure, not diffuse fibrosis. And the correct answer is honeycomb appearance. Correct. Interstitial pulmonary fibrosis gives a honeycomb pattern. So, the right answer is option B. Honeycomb appearance. Question 21. Femoral hernia presenting with strangulation is treated by option A. Emergency surgery. Option B. Observation. Option C. Truss. Option D. Manual reduction only. The correct answer is option A. Emergency surgery. Let's go through the options. Observation. Observation risks bowel necrosis. Truss. A truss is never used for strangulation. Manual reduction only. Manual reduction risks reducing dead bowel. And the correct answer is emergency surgery. Correct. A strangulated femoral hernia is a surgical emergency requiring immediate operation. So, the right answer is option A. Emergency surgery. Question 22. Gunshot injury with complete transection of the common bile duct is managed by option A. Raux-en-Y hepatococcygeostomy. Option B. Primary end-to-end repair. Option C. T-tube alone. Option D. Observation. The correct answer is option A. Raux-en-Y hepatococcygeostomy. Let's go through the options. Primary end-to-end repair. Primary end-to-end repair of a fully transected duct tends to stricture. T-tube alone. A T-tube alone will not bridge a full transection. Observation. Observation is inappropriate. And the correct answer is Raux-en-Y hepatococcygeostomy. Correct. Complete common bile duct transection is reconstructed with a Raux-en-Y hepatococcygeostomy. So, the right answer is option A. Raux-en-Y hepatococcygeostomy. Question 23. In pelvic fracture with urethral injury, the first priority is option A. Cystoscopy. Option B. Urethral catheterization. Option C. Urethroplasty. Option D. Treatment of shock and hemorrhage. The correct answer is option D, treatment of shock and hemorrhage. Let's go through the options. Cystoscopy. Cystoscopy is not the first priority. Urethral catheterization. Blind catheterization risks worsening the tear. Urethroplasty. Urethroplasty is a delayed procedure. And the correct answer is treatment of shock and hemorrhage. Correct. The first priority in major pelvic trauma is resuscitation, treat shock and hemorrhage. So, the right answer is option D. Treatment of shock and hemorrhage. Question 24. Extravasation of urine following penile urethral injury is option A, superficial. Option B, deep. Option C, retroperitoneal. Option D, intraperitoneal. The correct answer is option A, superficial. Let's go through the options. Deep. Deep extravasation follows membranous injuries. Retroperitoneal. It is not retroperitoneal. Intraperitoneal. It is not intraperitoneal. And the correct answer is superficial. Correct. Penile, anterior, urethral rupture within Buchholz fascia causes superficial extravasation. So, the right answer is option A. Superficial. Question 25. Femoral artery injury is repaired by option A, embolization. Option B, ligation. Option C, end-to-end anastomosis. Option D, observation. The correct answer is option C, end-to-end anastomosis. Let's go through the options. Embolization. Embolization is not used for a repairable femoral artery. Ligation. Ligation risks limb loss. Observation. Observation risks ischemia. And the correct answer is end-to-end anastomosis. Correct. A femoral artery injury is repaired, ideally by end-to-end anastomosis or graft. So, the right answer is option C. End-to-end anastomosis. Question 26. Loss of the lower limb follows injury to which artery? Option A, external iliac. Option B, internal iliac. Option C, obturator. Option D, inferior epigastric. The correct answer is option A, external iliac. Let's go through the options. Internal iliac. The internal iliac supplies the pelvis, collaterals spare the limb. Obturator. The obturator artery is minor. Inferior epigastric. The inferior epigastric is a minor branch. And the correct answer is external iliac. Correct. External iliac artery injury threatens the whole lower limb blood supply. So, the right answer is option A. External iliac. Question 27. A patient in respiratory distress after cervical surgery most likely has option A, paralysis of the diaphragm. Option B, pneumonia. Option C, pulmonary embolism. Option D, anaphylaxis. The correct answer is option A, paralysis of the diaphragm. Let's go through the options. Pneumonia. Pneumonia is not the immediate post-op cause. Pulmonary embolism. PE is possible but less immediate specific here. Anaphylaxis. Anaphylaxis is less likely without a trigger. And the correct answer is paralysis of the diaphragm. Correct. After neck, e.g. thyroid, surgery, bilateral recurrent laryngeal phrenic involvement or airway compromise causes respiratory distress, diaphragmatic airway problem is the concern. So, the right answer is option A. Paralysis of the diaphragm. Question 28. Hydatid cysts of the liver are treated by option A. Aspiration alone. Option B. Antibiotics alone. Option C. Surgery with albendazole cover. Option D. Observation. The correct answer is option C. Surgery with albendazole cover. Let's go through the options. Aspiration alone. Aspiration alone risks anaphylaxis and spillage. Antibiotics alone. Antibiotics do not clear a hydatid cyst. Observation. Observation is inappropriate for symptomatic cysts. And the correct answer is surgery with albendazole cover. Correct hydatid liver cysts are removed surgically or pair under albendazole cover to prevent recurrence. So, the right answer is option C. Surgery with albendazole cover. Question 29. Traumatic pneumothorax is managed by option A. Needle aspiration only. Option B. Underwater seal drainage. Option C. Observation. Option D. Positive pressure ventilation. The correct answer is option B. Underwater seal drainage. Let's go through the options. Needle aspiration only. Needle aspiration alone is inadequate for a traumatic pneumothorax. Observation. Observation risks tension. Positive pressure ventilation. Positive pressure ventilation without a drain risks tension. And the correct answer is underwater seal drainage. Correct traumatic pneumothorax is treated with an intercostal underwater seal chest drain. So, the right answer is option B. Underwater seal drainage. Question 30. Paradoxical chest movement indicates option A. Tension pneumothorax. Option B. Flail chest. Option C. Hemothorax. Option D. Cardiac tamponade. The correct answer is option B. Flail chest. Let's go through the options. Tension pneumothorax. Tension pneumothorax pushes the mediastinum, not paradoxical movement. Hemothorax. Hemothorax dulls the base without paradox. Cardiac tamponade. Tamponade affects the heart, not chest wall movement. And the correct answer is flail chest. Correct, a flail segment moves paradoxically in on inspiration. So, the right answer is option B. Flail chest. Question 31. A scalp injury with bleeding is controlled by option A. Cautery only. Option B. Tourniquet. Option C. Pressure dressing. Option D. Ligation only. The correct answer is option C. Pressure dressing. Let's go through the options. Cautery only. Cautery alone is often insufficient for scalp bleeding. Tourniquet. A tourniquet cannot be applied to the scalp. Ligation only. Ligation alone is impractical for diffuse scalp bleeding. And the correct answer is pressure dressing. Correct, a firm pressure dressing controls scalp hemorrhage from its rich vascular layer. So, the right answer is option C. Pressure dressing. Question 32. Glottic carcinoma without metastasis is treated by option A. Total laryngectomy. Option B. External beam radiotherapy. Option C. Chemotherapy. Option D. Observation. The correct answer is option B. External beam radiotherapy. Let's go through the options. Total laryngectomy. Total laryngectomy is overtreatment for early glottic cancer. Chemotherapy. Chemotherapy alone is not curative here. Observation. Observation is inadequate. And the correct answer is external beam radiotherapy. Correct. Early glottic carcinoma without spread is treated by radiotherapy, was preserving. So, the right answer is option B. External beam radiotherapy. Question 33. Incomplete abortion is most commonly complicated by option A. Ectopic pregnancy. Option B. Uterine rupture. Option C. Ovarian torsion. Option D. Disseminated intravascular coagulation. The correct answer is option D. Disseminated intravascular coagulation. Let's go through the options. Ectopic pregnancy. Ectopic pregnancy is a separate diagnosis, not a complication of incomplete abortion. Uterine rupture. Uterine rupture is not the typical complication. Ovarian torsion. Ovarian torsion is unrelated. And the correct answer is disseminated intravascular coagulation. Correct. Retained products in incomplete septic abortion can trigger DIC. So, the right answer is option D. Disseminated intravascular coagulation. Question 34. The commonest carcinoma of the female genital tract is option A. Vulval carcinoma. Option B. Ovarian carcinoma. Option C. Endometrial carcinoma. Option D. Vaginal carcinoma. The correct answer is option C. Endometrial carcinoma. Let's go through the options. Vulval carcinoma. Vulval carcinoma is uncommon. Ovarian carcinoma. Ovarian carcinoma is less common than endometrial overall. Vaginal carcinoma. Vaginal carcinoma is rare. Cervical versus endometrial varies by region, flagged. And the correct answer is endometrial carcinoma. Correct. Endometrial carcinoma is the commonest genital tract cancer in many populations. So, the right answer is option C. Endometrial carcinoma. Question 35. Bacteriuria in pregnancy, if untreated, most often progresses to option A. Acute pyelonephritis. Option B. glomerulonephritis. Option C. Renal stones. Option D. Renal failure. The correct answer is option A. Acute pyelonephritis. Let's go through the options. Glomerulonephritis. It does not cause glomerulonephritis. Renal stones. It does not typically cause stones. Renal failure. Renal failure is a late complication, not the usual next step. And the correct answer is acute pyelonephritis. Correct. Untreated asymptomatic bacteriuria in pregnancy commonly progresses to acute pyelonephritis. So, the right answer is option A. Acute pyelonephritis. Question 36. Episiotomy involving skin and muscle only is graded as option A. Grade 2. Option B. Grade I. Option C. Grade 3. Option D. Grade 4. The correct answer is option A. Grade 2. Let's go through the options. Grade I. Grade I involves skin mucosa only. Grade 3. Grade 3 involves the anal sphincter. Grade 4. Grade 4 involves the rectal mucosa. And the correct answer is grade 2. Correct, an episiotomy through skin and perineal muscle, not the sphincter, is a second-degree tear equivalent. So, the right answer is option A. Grade 2. Question 37. Estrogen is responsible for all of the following except option A. Endometrial proliferation. Option B. Pigmentation of the areola of the breast. Option C. Breast duct development. Option D. Secondary sexual characteristics. The correct answer is option B. Pigmentation of the areola of the breast. Let's go through the options. Endometrial proliferation. Estrogen causes endometrial proliferation. Breast duct development. Estrogen develops breast ducts. Secondary sexual characteristics. Estrogen drives female secondary sexual characteristics. And the correct answer is pigmentation of the areola of the breast. Correct, areolar pigmentation is driven by MSH progesterone in pregnancy, not estrogen, so it is the exception. So, the right answer is option B. Pigmentation of the areola of the breast. Question 38. In the luteal phase of the normal cycle, which is not true? Option A. Progesterone rises. Option B. Luteinizing hormone rises further. Option C. Endometrium becomes secretory. Option D. Basal temperature rises. The correct answer is option B. Luteinizing hormone rises further. Let's go through the options. Progesterone rises. Progesterone rises in the luteal phase. Endometrium becomes secretory. The endometrium becomes secretory. Basal temperature rises. Basal temperature rises with progesterone. And the correct answer is luteinizing hormone rises further. Correct, LH does not rise further, it falls after the ovulatory surge, so this is not true. So, the right answer is option B. Luteinizing hormone rises further. Question 39. Anemia in pregnancy may result from all except option A. Hemolysis. Option B. Iron deficiency. Option C. Folate deficiency. Option D. Vitamin D deficiency. The correct answer is option D. Vitamin D deficiency. Let's go through the options. Hemolysis. Hemolysis can cause anemia. Iron deficiency. Iron deficiency is a common cause. Folate deficiency. Folate deficiency causes anemia. And the correct answer is vitamin D deficiency. Correct, vitamin D deficiency causes bone disease, not anemia. So, the right answer is option D. Vitamin D deficiency. Question 40. Cervical carcinoma most commonly causes death by option A. Infection. Option B. Hemorrhage. Option C. Metastasis to lymph nodes with ureteric obstruction. Option D. The correct answer is option C. Metastasis to lymph nodes with ureteric obstruction. Let's go through the options. Infection. Infection contributes but is not the main mechanism of death. Hemorrhage. Hemorrhage is a terminal event but not the commonest. Anemia. Anemia alone is not the main cause. And the correct answer is metastasis to lymph nodes with ureteric obstruction. Correct, cervical cancer commonly kills by pelvic nodal spread causing bilateral ureteric obstruction and renal failure. So, the right answer is option C. Metastasis to lymph nodes with ureteric obstruction. Question 41. In pelvic inflammatory disease, pyogenic infection spreads mainly by Option A. Arteries. Option B. Veins and lymphatics. Option C. Direct contact only. Option D. Peritoneal fluid. The correct answer is option B. Veins and lymphatics. Let's go through the options. Arteries. Arterial spread is not the main route for PID. Direct contact only. Direct contact alone is not the principal route. Peritoneal fluid. Peritoneal fluid spread is secondary. And the correct answer is veins and lymphatics. Correct. Pelvic infection spreads mainly via veins and lymphatics and the tubal lumen. So, the right answer is option B. Veins and lymphatics. Question 42. Endometriosis is best diagnosed by Option A. Laparoscopy. Option B. Ultrasound. Option C. CT scan. Option D. CA 125 alone. The correct answer is option A. Laparoscopy. Let's go through the options. Ultrasound. Ultrasound may miss small implants. CT scan. CT is poor for endometriosis. CA 125 alone. CA 125 alone is non-specific. And the correct answer is laparoscopy. Correct. Laparoscopy, direct visualization biopsy, is the gold standard for diagnosing endometriosis. So, the right answer is option A. Laparoscopy. Question 43. Which does not occur in normal pregnancy? Option A. Increased pigmentation. Option B. Dry scaly skin. Option C. Striae gravidarum. Option D. Spider navy. The correct answer is option B. Dry scaly skin. Let's go through the options. Increased pigmentation. Increased pigmentation is normal in pregnancy. Striae gravidarum. Striae gravidarum are normal. Spider navy. Spider navy are a normal estrogen effect. And the correct answer is dry scaly skin. Correct. Dry scaly skin is not a normal pregnancy change. So, the right answer is option B. Dry scaly skin. Question 44. Preterm labor is most commonly associated with an unstable lie due to Option A. Prematurity. Option B. Fibroid. Option C. Placenta previa. Option D. Polyhydramnios. The correct answer is option A. Prematurity. Let's go through the options. Fibroid. A fibroid is a less common cause. Placenta previa. Placenta previa affects presentation more than lie stability. Polyhydramnios. Polyhydramnios is a cause but not the commonest here. And the correct answer is prematurity. Correct. Prematurity, small fetus with room to move, is the commonest cause of an unstable lie. So, the right answer is option A. Prematurity. Question 45. Hemoglobin in a 1 to 3 day old neonate is about Option A. 18.5 to 14.5 grams per deciliter. Option B. 10 to 12 grams per deciliter. Option C. 8 to 10 grams per deciliter. Option D. 22 to 24 grams per deciliter. The correct answer is option A, 18.5 to 14.5 grams per deciliter. Let's go through the options. 10 to 12 grams per deciliter. 10 to 12 grams per deciliter is too low for a newborn. 8 to 10 grams per deciliter. 8 to 10 grams per deciliter is anemic. 22 to 24 grams per deciliter. 22 to 24 grams per deciliter is too high. And the correct answer is 18.5 to 14.5 grams per deciliter. Correct neonatal Hb in the first days is high, about 14.5 to 18.5 grams per deciliter. So, the right answer is option A, 18.5 to 14.5 grams per deciliter. Question 46. Breath holding spells in a child characteristically vanish by option A, 4 years of age. Option B, 1 year. Option C, 8 years. Option D, adolescence. The correct answer is option A, 4 years of age. Let's go through the options. 1 year. 1 year is too early for resolution. 8 years. 8 years is later than usual. Adolescence. They do not usually persist to adolescence. And the correct answer is 4 years of age. Correct breath holding spells typically resolve by about 4 years of age. So, the right answer is option A, 4 years of age. Question 47. Congenital hypothyroidism is earliest diagnosed by option A, clinical features. Option B, serum T4. Option C, bone ague. Option D, serum TSH. The correct answer is option D, serum TSH. Let's go through the options. Clinical features. Clinical features appear late, after damage. Serum T4. T4 falls but TSH is the screening marker. Bone ague. Bone age is a late change. And the correct answer is serum TSH. Correct, a raised serum TSH is the earliest and screening diagnostic marker of congenital hypothyroidism. So, the right answer is option D, serum TSH. Question 48. The stigmata of Down syndrome with a murmur most often indicates option A, patent ductus arteriosus. Option B, ventricular septal defect. Option C, atrioventricular canal defect. Option D, coarctation. The correct answer is option C, atrioventricular canal defect. Let's go through the options. Patent ductus arteriosus. PADA is not the characteristic Down lesion. Ventricular septal defect. A simple VSD is common but not the classic pairing. Coarctation. Coarctation is not typical of Down syndrome. And the correct answer is atrioventricular canal defect. Correct, atrioventricular, endocardial cushion, canal defect is the characteristic Down syndrome cardiac lesion. So, the right answer is option C, atrioventricular canal defect. Question 49. Malrotation of the gut most characteristically causes option A, rectal bleeding. Option B, chronic constipation. Option C, diarrhea. Option D, volvulus with obstruction of blood flow. The correct answer is option D, volvulus with obstruction of blood flow. Let's go through the options. Rectal bleeding. Rectal bleeding is not the classic presentation. Chronic constipation. Chronic constipation is not typical. Diarrhea. Diarrhea is not the hallmark. And the correct answer is volvulus with obstruction of blood flow. Correct malrotation predisposes to midwet volvulus with compromised blood flow. So, the right answer is option D. Volvulus with obstruction of blood flow. Question 50. A child with hypoparathyroidism characteristically has option A. Hypophosphatemia, option B. Hyperphosphatemia, option C. Hypercalcemia, option D. Hypernatremia. The correct answer is option B. Hyperphosphatemia. Let's go through the options. Hypophosphatemia. Hypoparathyroidism does not cause low phosphate. Hypercalcemia. Calcium is low, not high. Hypernatremia. Sodium is unaffected. And the correct answer is hyperphosphatemia. Correct low PTH raises serum phosphate, hyperphosphatemia, with hypocalcemia. So, the right answer is option B. Hyperphosphatemia. Question 51. A child with hyperparathyroidism characteristically has option A. Hyponatremia, option B. Hypocalcemia, option C. Hyperkalemia, option D. Hypercalcemia. The correct answer is option D. Hypercalcemia. Let's go through the options. Hyponatremia. Hyperparathyroidism does not cause hyponatremia. Hypocalcemia. Calcium is high, not low. Hyperkalemia. Potassium is not the key change. And the correct answer is hypercalcemia. Correct excess PTH raises serum calcium, hypercalcemia. So, the right answer is option D. Hypercalcemia. Question 52. Torch complex comprises toxoplasma, rubella, cytomegalovirus and option A. Hepatitis B, option B. Herpes simplex virus, option C. Human papillomavirus, option D. Adenovirus. The correct answer is option B. Herpes simplex virus. Let's go through the options. Hepatitis B. Hepatitis B is not the H of torch. Human papillomavirus. HPV is not part of torch. Adenovirus. Adenovirus is not part of torch. And the correct answer is herpes simplex virus. Correct, the H in torch is herpes simplex virus. So, the right answer is option B. Herpes simplex virus. Question 53. Surgical complication of polycythemia in a child is option A. Hepatic failure, option B. Renal failure, option C. Cardiac failure, option D. Respiratory failure. The correct answer is option C. Cardiac failure. Let's go through the options. Hepatic failure. Hepatic failure is not the classic surgical complication. Renal failure. Renal failure is not the classic one. Respiratory failure. Respiratory failure is not the typical complication. And the correct answer is cardiac failure. Correct, polycythemia raises viscosity and can precipitate cardiac, heart failure. So, the right answer is option C. Cardiac failure. Question 54. A bulging tympanic membrane indicates option A. Otosclerosis, option B. Otitis media with effusion, option C. Acute otitis media, option D. Cholesteatoma. The correct answer is option C, acute otitis media. Let's go through the options. Otosclerosis. Otosclerosis gives a normal or Schwarzer syndrome, not bulging. Otitis media with effusion. Effusion gives a retracted dull drum. Cholesteatoma. Cholesteatoma gives an attic crust, not a bulging drum. And the correct answer is acute otitis media. Correct, a red bulging tympanic membrane indicates acute suppurative otitis media. So, the right answer is option C. Acute otitis media. Question 55. In chronic suppurative otitis media, the abscess most commonly forms in the option A, parietal lobe. Option B, frontal lobe. Option C, temporal lobe. Option D, occipital lobe. The correct answer is option C, temporal lobe. Let's go through the options. Parietal lobe. The parietal lobe is not the usual site. Frontal lobe. The frontal lobe is a less common site. Occipital lobe. The occipital lobe is not the usual site. And the correct answer is temporal lobe. Correct, otogenic brain abscess most often forms in the adjacent temporal lobe or cerebellum. So, the right answer is option C. Temporal lobe. Question 56. Malignant otitis externa is option A, a malignant tumor. Option B, a fungal infection. Option C, a viral infection. Option D, a pseudomonal infection. The correct answer is option D, a pseudomonal infection. Let's go through the options. A malignant tumor. It is not a malignant tumor despite the name. A fungal infection. It is not primarily fungal. A viral infection. It is not viral. And the correct answer is a pseudomonal infection. Correct, malignant, necrotizing, otitis externa is a pseudomonous infection usually in diabetics. So, the right answer is option D. A pseudomonal infection. Question 57. Tonsillectomy is indicated after how many years of recurrent tonsillitis? Option A, 1 year. Option B, 5 years of 3 episodes per year. Option C, 10 years. Option D, 2 months. The correct answer is option B, 5 years of 3 episodes per year. Let's go through the options. 1 year. 1 year alone is not the criterion. 10 years. 10 years is not the standard threshold. 2 months. 2 months is far too short. And the correct answer is 5 years of 3 episodes per year. Correct, recurrent tonsillitis meeting the Paradise criteria, e.g. multiple episodes year over years, indicates tonsillectomy. So, the right answer is option B. 5 years of 3 episodes per year. Question 58. Exposure to loud sound causing damage is defined as beyond. Option A, 12 hours. Option B, 1 hour. Option C, 4 hours. Option D, 24 hours. The correct answer is option C, 4 hours. Let's go through the options. 12 hours. 12 hours is not the standard threshold. 1 hour. 1 hour is not the defined limit. 24 hours. 24 hours is beyond the limit used. Depends on intensity flagged. And the correct answer is 4 hours. Correct. Noise exposure beyond about 4 hours at damaging levels risks hearing damage in this key. So, the right answer is option C. 4 hours. Question 59. Left sternocleidomastoid hypertrophy rotates the head to the option A, left side. Option B, right side. Option C, neither side. Option D, both sides. The correct answer is option B, right side. Let's go through the options. Left side. A left SCM does not turn the head to its own left side. Neither side. It does produce rotation. Both sides. It rotates to one side, not both. And the correct answer is right side. Correct. The left sternocleidomastoid rotates the head to the opposite, right side. So, the right answer is option B. Right side. Question 60. The parotid duct is repaired over A. Option A, drain. Option B, silk suture. Option C, wire. Option D, plastic tube stent. The correct answer is option D, plastic tube stent. Let's go through the options. Drain. A plain drain does not maintain duct patency. Silk suture. A silk suture does not stent the lumen. Wire. A wire is not used. And the correct answer is plastic tube stent. Correct. The parotid duct is repaired over a fine plastic tube stent to keep the lumen open. So, the right answer is option D. Plastic tube stent. Question 61. The tympanogram type as indicates. Option A, higher compliance. Option B, lower compliance. Option C, normal compliance. Option D, flat curve. The correct answer is option B, lower compliance. Let's go through the options. Higher compliance. Type as does not show higher compliance. Normal compliance. Type A, not as, is normal compliance. Flat curve. A flat curve is type B. And the correct answer is lower compliance. Correct type as shows reduced, shallow, compliance, as in otosclerosis. So, the right answer is option B. Lower compliance. Question 62. Post-tonsillectomy, the most important early complication is option A, pain. Option B, infection. Option C, reactionary hemorrhage. Option D, otalgia. The correct answer is option C, reactionary hemorrhage. Let's go through the options. Pain. Pain is expected and not the dangerous complication. Infection. Infection is a later complication. Otalgia. Referred otalgia is common but not dangerous. And the correct answer is reactionary hemorrhage. Correct. Reactionary hemorrhage within 24 hours is the most important early post-tonsillectomy complication. So, the right answer is option C. Reactionary hemorrhage. Question 63. Raised intraocular pressure is medically lowered by option A, atropine. Option B, acetazolamide. Option C, pilocarpine only. Option D, steroids. The correct answer is option B, acetazolamide. Let's go through the options. Atropine. Atropine raises pressure and precipitates glaucoma. Pilocarpine only. Pilocarpine alone is a topical miotic, not the systemic answer sought. Steroids. Steroids can raise intraocular pressure. And the correct answer is acetazolamide. Correct, acetazolamide reduces aqueous production and lowers intraocular pressure. So, the right answer is option B. Acetazolamide. Question 64. The treatment of choice for entamoeba histolytica is option A. Cotrimoxazole, option B. Ciprofloxacin, option C. Doxycycline, option D. Metronidazole. The correct answer is option D. Metronidazole. Let's go through the options. Cotrimoxazole. Cotrimoxazole is not first line for amoebiasis. Ciprofloxacin. Ciprofloxacin is not the drug of choice. Doxycycline. Doxycycline is not the treatment. And the correct answer is metronidazole. Correct, metronidazole is the treatment of choice for invasive entamoeba histolytica. So, the right answer is option D. Metronidazole. Question 65. Furosemide characteristically causes option A. Blindness, option B. Deafness, option C. Hepatitis, option D. Nephritis. The correct answer is option B. Deafness. Let's go through the options. Blindness. Furosemide does not cause blindness. Hepatitis. Hepatitis is not characteristic. Nephritis. Nephritis is not the classic effect. And the correct answer is deafness. Correct, furosemide is ototoxic and can cause, usually reversible, deafness. So, the right answer is option B. Deafness. Question 66. In hyperkalemia with peaked T waves, which is not used? Option A. Calcium gluconate, option B. Beta blocker, option C. Insulin with dextrose, option D. Salbutamol. The correct answer is option B. Beta blocker. Let's go through the options. Calcium gluconate. Calcium gluconate stabilizes the myocardium. Insulin with dextrose. Insulin with dextrose shifts potassium into cells. Salbutamol. Salbutamol, a beta agonist, shifts potassium intracellularly. And the correct answer is beta blocker. Correct, a beta blocker is not part of hyperkalemia treatment. Beta agonists, not blockers, are used. So, the right answer is option B. Beta blocker. Question 67. Drugs contraindicated in congestive cardiac failure include option A. NSAIDs and calcium channel blockers, option B. ACE inhibitors, option C. Diuretics, option D. Beta blockers in stable disease. The correct answer is option A. NSAIDs and calcium channel blockers. Let's go through the options. ACE inhibitors. ACE inhibitors are beneficial in CCF. Diuretics. Diuretics are used in CCF. Beta blockers in stable disease. Beta blockers are beneficial in stable CCF. And the correct answer is NSAIDs and calcium channel blockers. Correct, NSAIDs, fluid retention, and non-dehydropyridine calcium channel blockers worsen heart failure. So, the right answer is option A. NSAIDs and calcium channel blockers. Question 68. Chloramphenicol is contraindicated in breastfeeding because it causes Option A. Gray baby syndrome. Option B. Kernicterus. Option C. Deafness. Option D. Cataract. The correct answer is option A. Gray baby syndrome. Let's go through the options. Kernicterus. Kernicterus is linked to sulfonamides. Deafness. Deafness is linked to aminoglycosides. Cataract. Cataract is not a chloramphenicol effect. And the correct answer is Gray baby syndrome. Correct, chloramphenicol causes Gray baby syndrome in neonates who cannot conjugate it. So, the right answer is option A. Gray baby syndrome. Question 69. Which vaccine is a killed or inactivated preparation? Option A. Measles. Option B. BCG. Option C. Oral polio. Option D. Hepatitis B. The correct answer is option D. Hepatitis B. Let's go through the options. Measles. Measles vaccine is a live attenuated vaccine. BCG. BCG is live attenuated. Oral polio. Oral polio is live attenuated. And the correct answer is hepatitis B. Correct, hepatitis B vaccine is a killed recombinant, inactivated, subunit vaccine. So, the right answer is option D. Hepatitis B. Question 70. Excessive vitamin A in childhood causes. Option A. Ototoxicity. Option B. Nephrotoxicity. Option C. Cardiotoxicity. Option D. Hepatotoxicity. The correct answer is option D. Hepatotoxicity. Let's go through the options. Ototoxicity. Vitamin A excess is not primarily ototoxic. Nephrotoxicity. It is not primarily nephrotoxic. Cardiotoxicity. It is not primarily cardiotoxic. And the correct answer is hepatotoxicity. Correct, hypervitaminosis causes hepatotoxicity and raised intracranial pressure. So, the right answer is option D. Hepatotoxicity. Question 71. Vitamin K in excess causes. Option A. Hyperglycemia. Option B. Hypocalcemia. Option C. Hypokalemia. Option D. Hyperbilirubinemia. The correct answer is option D. Hyperbilirubinemia. Let's go through the options. Hyperglycemia. Vitamin K excess does not cause hyperglycemia. Hypocalcemia. It does not cause hypocalcemia. Hypokalemia. It does not cause hypokalemia. And the correct answer is hyperbilirubinemia. Correct, excess vitamin K, menadione, can cause hemolysis and hyperbilirubinemia in neonates. So, the right answer is option D. Hyperbilirubinemia. Question 72. Orbital hemangioma is best investigated by. Option A. CT without contrast. Option B. Plain X-ray. Option C. Ultrasound only. Option D. MRI. The correct answer is option D. MRI. Let's go through the options. CT without contrast. CT without contrast is not the best modality for a vascular orbital lesion. Plain X-ray. Plain X-ray is inadequate. Ultrasound only. Ultrasound alone is limited for deep orbit. And the correct answer is MRI. Correct, MRI best characterizes an orbital hemangioma and its soft tissue extent. So, the right answer is option D. MRI. Question 73. Red eye occurs in all of the following except option A. Acute glaucoma, option B. Retinitis pigmentosa, option C. uveitis, option D. Conjunctivitis. The correct answer is option B. Retinitis pigmentosa. Let's go through the options. Acute glaucoma. Acute glaucoma causes a red eye. Uveitis. Uveitis causes a red eye. Conjunctivitis. Conjunctivitis causes a red eye. And the correct answer is retinitis pigmentosa. Correct. Retinitis pigmentosa gives night blindness and field loss, not a red eye. So, the right answer is option B. Retinitis pigmentosa. Question 74. A contact lens wearer with a negative fluorescein test and giant papillae has option A. Giant papillary conjunctivitis, option B. Bacterial keratitis, option C. Herpes keratitis, option D. Trachoma. The correct answer is option A. Giant papillary conjunctivitis. Let's go through the options. Bacterial keratitis. Bacterial keratitis stains with fluorescein. Herpes keratitis. Herpes keratitis gives a dendritic staining ulcer. Trachoma. Trachoma gives tarsal follicles and scarring, not this picture. And the correct answer is giant papillary conjunctivitis. Correct. A contact lens wearer with giant papillae and an intact, fluorescein-negative cornea has giant papillary conjunctivitis. So, the right answer is option A. Giant papillary conjunctivitis. Question 75. Consecutive optic atrophy is associated with option A. Presbyopia, option B. Hypermetropia, option C. Astigmatism, option D. Myopia. The correct answer is option D. Myopia. Let's go through the options. Presbyopia. Presbyopia is an aging lens problem, not optic atrophy. Hypermetropia. Hypermetropia is not linked to consecutive optic atrophy. Astigmatism. Astigmatism is unrelated. And the correct answer is myopia. Correct. High myopia with retinal chorioretinal degeneration is associated with consecutive optic atrophy. So, the right answer is option D. Myopia. Question 76. Exposure keratitis results from option A. Corneal ulcer, option B. Excessive blinking, option C. Inability to close the eye, option D. Raised pressure. The correct answer is option C. Inability to close the eye. Let's go through the options. Corneal ulcer. A corneal ulcer is a result, not the cause of exposure keratitis. Excessive blinking. Excessive blinking protects the cornea. Raised pressure. Raised pressure causes glaucoma, not exposure keratitis. And the correct answer is inability to close the eye. Correct. Failure to close the eye, e.g. facial palsy, proptosis, causes exposure keratitis. So, the right answer is option C. Inability to close the eye. Question 77. Retinal ischemia in diabetes leads to option A. Ptosis, option B. Cataract, option C. Glaucoma only, option D. Neovascularization. The correct answer is option D. Neovascularization. Let's go through the options. Ptosis. Ptosis is not the diabetic retinal response. Cataract. Cataract is a separate diabetic complication. Glaucoma only. Glaucoma is a consequence but not the primary response to ischemia. And the correct answer is neovascularization. Correct retinal ischemia drives wake-mediated neovascularization, proliferative retinopathy. So, the right answer is option D. Neovascularization. Question 78. Oil drop cataract is characteristically caused by option A. Radiation. Option B. Diabetes. Option C. Age. Option D. Steroids or trauma. The correct answer is option D. Steroids or trauma. Let's go through the options. Radiation. Radiation cataract is posterior subcapsular, not oil drop. Diabetes. The oil drop appearance is classically galactosemia, not typical diabetes. Age. Age gives nuclear cataract. And the correct answer is steroids or trauma. Correct. Per key, trauma steroid-related lens change is chosen here. Note oil drop is classically galactosemia. Flagged. So, the right answer is option D. Steroids or trauma. Question 79. Snowflake cataract is characteristic of option A. Steroid use. Option B. Diabetes mellitus. Option C. Trauma. Option D. Old age. The correct answer is option B. Diabetes mellitus. Let's go through the options. Steroid use. Steroid cataract is posterior subcapsular, not snowflake. Trauma. Trauma gives a russet cataract. Old age. Old age gives nuclear sclerosis. And the correct answer is diabetes mellitus. Correct. The snowflake, snow white flecks, cataract is characteristic of young diabetics. So, the right answer is option B. Diabetes mellitus. Question 80. A jaw mass in a 7-year-old African child suggests option A. Burkitt lymphoma. Option B. Osteosarcoma. Option C. Ameloblastoma. Option D. Fibrous dysplasia. The correct answer is option A. Burkitt lymphoma. Let's go through the options. Osteosarcoma. Osteosarcoma is not the classic African jaw tumor. Ameloblastoma. Ameloblastoma is a slow adult jaw tumor. Fibrous dysplasia. Fibrous dysplasia is not the classic lymphoproliferative jaw mass. And the correct answer is Burkitt lymphoma. Correct. A jaw mass in an African child is classically Burkitt lymphoma. So, the right answer is option A. Burkitt lymphoma. Question 81. Juvenile polyps in large numbers increase the risk of option A. Bleeding only. Option B. Intussusception only. Option C. Carcinoma. Option D. Nothing. The correct answer is option C. Carcinoma. Let's go through the options. Bleeding only. Bleeding alone understates the risk of numerous polyps. Intussusception only. Intussusception alone understates it. Nothing. Saying nothing is wrong. And the correct answer is carcinoma. Correct. Juvenile polyposis, many polyps, carries an increased risk of colorectal carcinoma. So, the right answer is option C. Carcinoma. Question 82. multiple myeloma is characterized by all except Option A. Lytic bone lesions. Option B. Benz-Jones proteinuria. Option C. Heavy chain disease. Option D. Rouleaux formation. The correct answer is option C. Heavy chain disease. Let's go through the options. Lytic bone lesions. Lytic bone lesions occur in myeloma. Benz-Jones proteinuria. Benz-Jones proteinuria occurs. Rouleaux formation. Rouleaux formation occurs. And the correct answer is heavy chain disease. Correct. Heavy chain disease is a separate entity. Myeloma is a light chain plasma cell disorder, so this is the exception. So, the right answer is option C. Heavy chain disease. Question 83. Lipoma does not occur in the Option A. Intracranial cavity. Option B. Subcutaneous tissue. Option C. Retroperitoneum. Option D. Intermuscular plane. The correct answer is option A. Intracranial cavity. Let's go through the options. Subcutaneous tissue. Lipomas are common in subcutaneous tissue. Retroperitoneum. Lipomas occur in the retroperitoneum. Intermuscular plane. Lipomas occur in intermuscular planes. And the correct answer is intracranial cavity. Correct. Lipomas do not arise inside the cranial cavity. Brain has no adipose tissue in the usual sense. So, the right answer is option A. Intracranial cavity. Question 84. Pleomorphic adenoma most commonly occurs in the 5th to 6th decade in the Option A. Parotid gland. Option B. Thyroid. Option C. Breast. Option D. Submandibular gland. The correct answer is option A. Parotid gland. Let's go through the options. Thyroid. The thyroid is not a salivary gland. Breast. The breast is not the site. Submandibular gland. The submandibular gland is a less common site. And the correct answer is parotid gland. Correct. Pleomorphic adenoma most commonly arises in the parotid gland. So, the right answer is option A. Parotid gland. Question 85. Follicular carcinoma of the thyroid is not diagnosed by Option A. Excision biopsy. Option B. Fine needle aspiration cytology. Option C. Histology. Option D. Frozen section. The correct answer is option B. Fine needle aspiration cytology. Let's go through the options. Excision biopsy. Excision biopsy shows capsular vascular invasion. Histology. Histology confirms invasion. Frozen section. Frozen section can assess it. Answer key debatable for frozen section flagged. And the correct answer is fine needle aspiration cytology. Correct. FNAC cannot diagnose follicular carcinoma because it cannot show capsular invasion. So, the right answer is option B. Fine needle aspiration cytology. Question 86. Undercooked meat most commonly transmits. Option A. Hookworm. Option B. Roundworm. Option C. Tapeworm. Option D. Threadworm. The correct answer is option C. Tapeworm. Let's go through the options. Hookworm. Hookworm is acquired through skin, not meat. Roundworm. Roundworm, Ascaris, is fecaloral via soil. Threadworm. Threadworm spreads by the fecal-oral route. And the correct answer is tapeworm. Correct. Undercooked meat transmits tapeworm tinea. So, the right answer is option C. Tapeworm. Question 87. The incubation period of mumps is option A 14 to 21 days. Option B 2 to 3 days. Option C 30 to 45 days. Option D 2 months. The correct answer is option A 14 to 21 days. Let's go through the options. 2 to 3 days. 2 to 3 days is too short. 30 to 45 days. 30 to 45 days is too long. 2 months. 2 months is far too long. And the correct answer is 14 to 21 days. Correct. The incubation period of mumps is about 14 to 21 days. So, the right answer is option A. 14 to 21 days. Question 88. Nasopharyngeal carcinoma is most common in which population? Option A, Chinese. Option B, European. Option C, African. Option D, South American. The correct answer is option A, Chinese. Let's go through the options. European. It is uncommon in Europeans. African. It is not most common in Africans. South American. It is not most common in South Americans. And the correct answer is Chinese. Correct. Nasopharyngeal carcinoma is most common in Chinese Southeast Asian populations, EBV, diet. So, the right answer is option A. Chinese. Question 89. Which is not a waterborne disease? Option A, hepatitis A. Option B, cholera. Option C, typhoid. Option D, measles. The correct answer is option D, measles. Let's go through the options. Hepatitis A. Hepatitis A is waterborne. Cholera. Cholera is waterborne. Typhoid. Typhoid is waterborne. And the correct answer is measles. Correct. Measles is airborne, droplet, not waterborne. So, the right answer is option D. Measles. Question 90. Blood sent for culture while awaiting the result should be covered with option A, steroids. Option B, no antibiotic. Option C, penicillin. Option D, antifungal. The correct answer is option C, penicillin. Let's go through the options. Steroids. Steroids are not the empirical cover. No antibiotic. Waiting with no cover risks deterioration in a septic patient. Antifungal. An antifungal is not the empirical choice. And the correct answer is penicillin. Correct. After taking cultures, empirical antibiotic, e.g. penicillin, cover is started pending results. So, the right answer is option C. Penicillin. Question 91. Christie of the semicircular canals respond to option A, angular acceleration. Option B, linear acceleration. Option C, gravity. Option D, sound. The correct answer is option A, angular acceleration. Let's go through the options. Linear acceleration. Linear acceleration is sensed by the otolith organs. Gravity. Gravity is sensed by the maculae. Sound. Sound is sensed by the cochlea. And the correct answer is angular acceleration. Correct. The cristae of the semicircular canals sense angular, rotational acceleration. So, the right answer is option A. Angular acceleration. Question 92. The utricle and saccule contain which sensory structure? Option A. Macula. Option B. Crista ampullaris. Option C. Organ of Corti. Option D. Tectorial membrane. The correct answer is option A. Macula. Let's go through the options. Crista ampullaris. The crista ampullaris is in the semicircular canals. Organ of Corti. The organ of Corti is in the cochlea. Tectorial membrane. The tectorial membrane is a cochlear structure. And the correct answer is macula. Correct. The utricle and saccule contain the macula with otoliths. So, the right answer is option A. Macula. Question 93. Perilymph is produced from option A. Cochlear blood flow. Option B. Stria vascularis. Option C. Endolymphatic sac. Option D. Cerebrospinal fluid only. The correct answer is option A. Cochlear blood flow. Let's go through the options. Stria vascularis. The stria vascularis produces endolymph, not perilymph. Endolymphatic sac. The endolymphatic sac handles endolymph. Cerebrospinal fluid only. It is not derived solely from CSF. And the correct answer is cochlear blood flow. Correct. Perilymph is largely an ultrafiltrate related to cochlear blood flow plasma and continuous with CSF. So, the right answer is option A. Cochlear blood flow. Question 94. The swallowing reflex center lies in the option A. Medulla and pons. Option B. Midbrain. Option C. Cerebellum. Option D. Thalamus. The correct answer is option A. Medulla and pons. Let's go through the options. Midbrain. It is not in the midbrain. Cerebellum. It is not in the cerebellum. Thalamus. It is not in the thalamus. And the correct answer is medulla and pons. Correct. The swallowing, deglutition, center lies in the medulla and pons. So, the right answer is option A. Medulla and pons. Question 95. Vitamin B12 is absorbed in the option A. Colon. Option B. Duodenum. Option C. Jejunum. Option D. Terminal ileum. The correct answer is option D. Terminal ileum. Let's go through the options. Colon. The colon does not absorb B12. Duodenum. The duodenum is not the site. Jejunum. The jejunum is not the site. And the correct answer is terminal ileum. Correct. Vitamin B12 with intrinsic factor is absorbed in the terminal ileum. So, the right answer is option D. Terminal ileum. Question 96. The medial wall of the orbit is formed by all except the option A. Lacrimal bone. Option B. Ethmoid. Option C. Palatine bone. Option D. Maxilla. The correct answer is option C. Palatine bone. Let's go through the options. Lacrimal bone. The lacrimal bone forms part of the medial orbital wall. Ethmoid. The ethmoid forms most of the medial wall. Maxilla. The maxilla, frontal process, contributes to the medial wall. And the correct answer is palatine bone. Correct, the palatine bone contributes to the floor apex, not the medial wall, so it is the exception. So, the right answer is option C. Palatine bone. Question 97. The cricoid cartilage lies at which vertebral level? Option A, C6. Option B, C4. Option C, T1. Option D, C2. The correct answer is option A, C6. Let's go through the options. C4. C4 is the level of the thyroid cartilage upper border. T1. T1 is too low. C2. C2 is too high. And the correct answer is C6. Correct, the cricoid cartilage lies at the C6 vertebral level. So, the right answer is option A. C6. Question 98. The ascending colon is option A, retroperitoneal. Option B, intraperitoneal. Option C, mesenteric. Option D, extraperitoneal only. The correct answer is option A, retroperitoneal. Let's go through the options. Intraperitoneal. The transverse and sigmoid colon are intraperitoneal, not the ascending. Mesenteric. It does not have its own mesentery normally. Extraperitoneal only. It is retroperitoneal, not fully extraperitoneal. And the correct answer is retroperitoneal. Correct, the ascending colon is retroperitoneal secondarily. So, the right answer is option A. Retroperitoneal. Question 99. The first enzyme to rise after myocardial infarction is option A, lactate dehydrogenase. Option B, creatine kinase MB. Option C, aspartate transaminase. Option D, alkaline phosphatase. The correct answer is option B, creatine kinase MB. Let's go through the options. Lactate dehydrogenase. LDH rises late. Aspartate transaminase. AST rises after CK. Alkaline phosphatase. ALP is unrelated to AMI. And the correct answer is creatine kinase MB. Correct, CKMB rises early, within hours, after myocardial infarction. Troponin is more specific, but CKMB is the classic early enzyme. So, the right answer is option B. Creatine kinase MB. Question 100. Insensible water loss from skin and lungs per day is about option A, 900 milliliters. Option B, 300 milliliters. Option circa 1500 milliliters. Option D, 2500 milliliters. The correct answer is option A, 900 milliliters. Let's go through the options. 300 milliliters. 300 milliliters underestimates it. 1500 milliliters. 1500 milliliters overestimates skin plus lung loss, closer to urine. 2500 milliliters. 2500 milliliters is total daily output, not insensible loss. And the correct answer is 900 milliliters. Correct, insensible loss from skin and lungs is about 900 milliliters day. So, the right answer is option A. 900 milliliters.